Yeah, testing video.
Okay.
Yeah. All right. Dr. Jomar, welcome and thank you so much for accepting the invite. I very do much appreciate your time and feel very grateful for you.
Thank you. I'd like to thank you for the invitation, and also Juliana.
Yes. This would not have been made without her, actually.
Probably not.
Yes.
Nobody knows me here.
I honestly don't know how does she bring the guests. I also heard that you have a secret.
Okay, yeah, that's important.
Doctor, just as a starter, can you please introduce yourself? Tell us who is Dr. Jomar and why do you do what you do?
Okay, so I'm Jomar Souza. I'm a sports medicine physician. I finished my medical school in Brazil in 1993 and my post-graduation degree in sports medicine in 1995. So it's quite a long time ago. Yeah, and in 2016, I was working for a sports medicine hospital in Doha. I stayed there for about 3 years. During the pandemic, I was back in Brazil. I worked in Brazil during 2 years. And in 2021, I received an invitation to join the up and running clinic medical center here in Dubai. So I'm here since November 2021, working as a sports medicine physician here in Dubai.
All right, wonderful. Doctor, let's start with the basics. What does a sports medicine doctor do?
It's easier to tell you what a sports medicine physician doesn't do. It's more easy to explain that.
Yeah.
We do lots of things, lots of things. I can tell you that a sports medicine physician, it's like a GP that focus on the exercise to promote health and to treat several diseases. So sports medicine is not only to treat elite or professional athletes. Our field of work is more larger than this. So we used to see patients with injuries for sure. Most of the time we see patients with injuries, all kinds of injuries, but also we see patients that want to improve their performance as amateur athletes. They want to help to control the weight, not only to lose weight, but also to gain muscle mass. We see patients with some concerns regarding any cardiovascular symptom related to the exercise. For example, last week I saw a lady, 35 years old, that had some palpitations during her regular exercise, and we performed a stress cardiovascular test with her. We see patients with diabetes that want to use and need to use the exercise as another kind of treatment to help the endocrinologist for a better control of the glycemia. We see patients with neurological issues where the exercise can help them to improve the quality of life. For example, patients with Parkinson's disease. We see patients that already finished chemotherapy for the treatment of cancer, and they need to recover the cardiovascular endurance, they need to recover the muscle mass, they need to help to prevent the recurrence of several types of cancer. So it's a very large field of work that the sports medicine physician has. For sure, I can tell you that 80, maybe 9% of the patient that you see in an OPD clinic is patient with some several injuries related to any kind of exercise or any kind of sport. But we can see all of those kinds of the patients in a daily basis.
Wonderful. Doctor, speaking of sports medicine, how can we use sports as a tool to prevent, let's say, diseases? In other words, can we say that sports eliminates, let's say, a huge portion of the current day diseases?
if we think about a lack of exercise as an epidemic or as a pandemic, and most of the deaths around the world are related to the lack of exercise for cardiovascular disease, for obesity, for diabetes, for stroke. Exercise or sport has a pretty important role in preventing this kind of deaths. Okay, for sure, sports medicine, exercise, sports are not the only treatment that most of people need to do to preserve their health or to recover their health. Okay, but for sure, exercise as a good nutrition, that the basics for someone that needs to improve the health. Okay, so that's the main thing. A sports medicine physician cannot believe that only the exercise will help the patient to prevent the disease or to help the patient if a disease is already there on the body or on the mind. Okay, this is a topic, okay? But exercise play maybe together with a good nutrition, the mainstream to a good health.
Wonderful. Now, something that crossed my mind is that speaking of sports and physical activities, let's say, for example, if I came to you right now, how would you determine from the metrics whether my health is good or not? Like, how can we say that this person has a healthy metrics or not? Speaking of their, let's say, blood pressure, hypertension, and so on.
That's a pretty good question. We have lots of measures that you can do in a simple medical consultation that provide us with the information that I can tell you, okay, you're a health guy. Okay, the first thing is the relation between your height and weight. Okay, the body mass index. This is, generally speaking, this is a pretty good start. Okay, we know that a normal body mass index is around 18 and 25. If someone is between 25 and 29, is a person that we say that is overweight, and above 29 is an obese patient. Okay, but that's important to know that there are some people with high BMI, body mass index, and they're not obese. It's a guy, for example, that has a pretty good muscle mass. Okay, but this is a good point of start. Okay, for sure. If I listen to your heart and there is no strange sounds on your heart, no abnormal sound, if I listen to your lungs and there is no abnormal sound, on your lungs, if your pulse is regular, there is no arrhythmias, if you don't have any personal or family history of cardiovascular disease, stroke, loss of consciousness, especially related to exercise, we can say that we're facing a patient that apparently at the beginning is a health individual. Okay, but one important question: do you do any kind of exercise? That's very important, because doesn't matter how healthy you are, if you don't do exercise, very, very quickly during your life, you will lose your health status. Okay, so how much exercise do you do? We know by the research that we need to do at least 90 minutes of aerobic exercise per week in a moderate intensity. Okay, the perfect guy is the one that does 150 minutes of exercise every week in a moderate to a high intensity. Okay, that's not Dr. Jomar that is telling you that. Is the World Health Organization, is the CDC in United States, is the FDA, is the International Federation of Sports Medicine. So that's a pretty important question. What kind of exercise do you do? How much exercise do you do per week? And which intensity of exercise? So if you say, yes, I do the exercise, and you have all the other parameters that are normal, we can say to you that you're a healthy guy.
Wonderful. Doctor, why is exercise very good for the humans? What does exercise do to our physiology, let's say?
Let me compare our bodies with a Ferrari. Okay, let's say that you buy a Ferrari. I suppose that you have at least one Ferrari. And you buy the Ferrari and you store the Ferrari inside your garage. And you don't use the Ferrari. It's an amazing machine. Okay, it's an amazing machine. Okay, but leave the Ferrari in your garage, lock it for 1 year. And after that, try to start the engine. You have problems.
I see.
Okay, with that. So doesn't matter how good is your machine. If you don't use the machine that was built to moving around like our bodies, okay, we will face problems. So the exercise will make our cardiovascular system, our respiratory system, our musculoskeletal system to work in a way that keep them working normally without any problems when you need to start the engine, let's say that way. Okay, so for example, if we're thinking about chronic disease like obesity, diabetes, osteoporosis, Alzheimer's disease, Parkinson's disease, the exercise can help the patient to prevent most of them, including sometimes of cancer. For women, we know evidence-based papers in medicine is stating that a woman that exercises regularly has a less chance to develop a breast cancer. For men, less chance to develop prostate cancer or colon cancer. Okay, so if you want to live longer but with a good quality of life, it's important to start your Ferrari and to drive your Ferrari around every single day. Otherwise, one day that you need your Ferrari and you try to start the engine has a problem, you cannot start your Ferrari.
I love that. So, like, even though that we have a great machine that is our bodies, not using it is going to damage it more than if we use it properly. Beautiful.
Exactly. And that's a pretty important term, properly. Okay? So extraneous exercise, competitive exercise, professional exercise is not health. Okay? So if you drive your Ferrari every single day in the maximum speed, the engine will be broken. Okay?
Very true.
So it's not to be a sedentary person, it's not to be a professional athlete. Okay? The virtue is the center. Okay? So it's the amount of exercise that makes you health. Okay? So strenuous exercise is not the health. I remember my first Congress of Sports Medicine that I was as a attendee in 1993 was in São Paulo in Brazil, and I saw an amazing presentation from a doctor called Gilberto Carazato from São Paulo University. His first slide for that presentation is stated that competitive sports is not health. So someone could ask me why you need sports, why you need world championships, why we have Olympic Games. Because there is someone that's a professional in that area, that is the athlete, that is paid for that, and that athlete takes the risk regarding his profession. I'm a doctor, so I'm not a surgeon, but I'm a physician. I'm a doctor, a clinician, but I had to be training in surgery during the medical school. And that carries the risks to get AIDS, to get hepatitis C, hepatitis B. So I took the risk because it was my profession, it was my training. So every professional athlete, every elite athlete take the risk to get an injury or to develop any cardiovascular disease that in the future can prevent him or her to continue participating in sports.
Very true. Actually, for example, let's say about the sport of bodybuilding, like the people who step on the stage, they get to a point of an extreme, let's say, low body fat percentage, which is considered like not healthy and dangerous for the body, which now reminded me of what you just said, like competitive professional sports are not always healthy.
Exactly. And we have a serious problem around the world regarding competitive sports that can make these athletes' health worse is the use of anabolic steroids
True.
to improve the muscle mass, to improve the power, the strength, So we have lots of side effects regarding the use of anabolic steroids. We have a serious discussion now in Brazil about that because unfortunately there we have lots of physicians that are prescribing that for aesthetical reasons, just to reduce the body fat, that to increase the muscle mass, and lots of people having side effects with that use. And last week we had online seminar about that together with the people from the Brazilian Council of Medicine, and we prepared a letter to the Brazilian Society talking about the risk of this abuse of anabolic steroids.
Doctor, can we talk about the risks of the use of anabolic steroids? Because I know that many people, many sports, wherever there's a competition where money is on the line, there is the usage of anabolic steroids. So, what are the dangers and side effects of anabolic steroids?
Let's start with the less dangerous for life, okay? Not life-threatening side effects. Tendon ruptures, okay? The anabolic steroids act on the muscle belly, but not on the tendons. The tendon is the structure that is a bridge between the muscle and the bone, okay? So once the muscle contracts, the tendon will pull the bone to generate a movement, okay? So imagine that you have a big, strong muscle and you have a tiny tendon. Along the time, with the increase of the weight that the muscle is capable to lift, the tendon will get a tear. And most of the time, this tear needs to be repaired surgically, okay? So this is a not life-threatening side effect, okay? Let's talk about the life-threatening side effects. Inflammation on the heart muscle, on the myocardium, that we call hypertrophic myocarditis, that can generate lots of arrhythmias and that can cause a cardiac arrest, okay? This is one example. The second one, the anabolic steroids will increase the number of the red cells on the bloodstream, okay? So the blood can form clots more easily with this increased number of red blood cells. And this can cause a stroke and myocardial infarction. Increased in high blood pressure, okay? So once you make the bone, once you make the blood has more red blood cells, okay, takes more effort from the heart to pump this blood on the bloodstream, and this can create a rise in the blood pressure, okay? Other problem, liver tumors. I'm not talking about only cancer. I'm not talking only about malignant tumors in the liver, but also benign tumors. And for example, for someone that does contact sports, if there is an increased size on the liver because of tumor during an impact, for example, for a rugby player, this guy, this girl can have a liver trauma with internal
Oh,
bleeding that can cause death. Okay. Another problem that's life-threatening, as I told you, is strokes. Strokes are more common in people that use anabolic steroids, than in a person that don't use them. So we have lots of important side effects that are life-threatening and others that are not. Okay,
mm-hmm.
and on the side of the mental health, anabolic steroids are like drugs for the brain. Okay,
Oh,
like cocaine, like marijuana, like opioid analgesics. So this can create a dependency of someone that are taking, and it's pretty difficult for this guy to stop to using that. Okay,
I
so
see.
it's also a psychiatric issue, and this can increase the chance of a patient that has, for example, depression, a severe depression. This can increase the risk of suicide.
I see. That's actually very dangerous, and not a lot of people know that. Because I know many people, like as a beginning in the gym, they just take a anabolic steroid without knowing all these side effects. And then after that, they start noticing all these, let's say, side effects, and they just don't know what to do. Thank you for the insight, doctor. Now, let's talk about what's the difference between a sports medicine physician and an orthopedic surgeon?
That's a pretty good question. Lots of people confuse orthopedic surgeon with a sports medicine physician, especially when you're talking about professional soccer, professional football. Okay, so both of them are trained to manage sports injuries. Okay, the difference is that a sports medicine physician is trained in other areas of the medicine, like cardiology, pediatrics, endocrinology, and so on.
Mm-hmm.
So it's a more comprehensive training for a sports medicine physician. The training for orthopedic surgeon is a more deep training into the surgical treatment of sports injuries.
Mm-hmm.
I'll give you a very, very easy example to understand that. Let's say that I receive a patient in my office, and this patient has an anterior cruciate ligament injury.
Mm-hmm.
I'm trained to understand the mechanism of injury. I'm trained to do the correct diagnosis, the clinical diagnosis. I'm trained to order the image scan to confirm my clinical diagnosis, but I'm not trained to reconstruct the ligament. In
Mm-hmm.
this case, I need to refer this patient for orthopedic surgeon, for a knee surgeon to reconstruct the ligament.
I
Okay.
see.
Usually, what has happened is that after surgery, the orthopedic surgeon refers this patient back to the sports medicine physician, and the sports medicine physician, together with the physiotherapist team, will help to rehabilitate this patient and to put this patient back on the field. Okay, so
Uh-huh.
the training for orthopedic surgeon it's only on MSK, and they have a more deep knowledge in surgical treatment, while a sports medicine physician has a broad training in lots of different aspects of the medicine, but they're not trained to perform surgeries.
I see. I see. Thank you for this explanation. So, like, I mean, in this case, an orthopedic surgeon is, let's say, going to tackle a certain problem surgically, and the sports medicine physician have the capacity to diagnose, identify. Then, in case of a surgery, it's going to be referred to the surgeon.
Exactly.
I
But
see.
it's very important to note that, for example, if the same patient, instead of to come to my office, goes directly to orthopedic surgeon, the orthopedic surgeon will do the clinical diagnosis,
Mm-hmm.
will order the same image scan, okay, and can refer the patient and can perform the surgery,
Mm-hmm.
okay. But for example, orthopedic surgeon, if orthopedic surgeon receives a patient that wants to improve the physical performance, for example, for a better weight control, the
Hmm.
orthopedic surgeon is not trained for that.
I see.
Okay, so it's like a sports medicine physician is a GP.
Hmm.
Okay, and orthopedic surgeon is a more specialized specialty in that kind of surgical treatment.
I see. Thank you, doctor. Doctor, does the sport medicine physician like address only elite professionals, or can you, let's say, for example, do you receive patients or clients who are just normal people, or do you treat normally athletes?
We can see both, but if you're thinking about a sports medicine clinic, we see more patients that are not elite athletes than
Hmm.
elite athletes. Just to give you another example, as I told you, I finished my medical school in 1993. So during the past 30 years, I worked with a sport club only during 10 years.
Hmm.
So the rest of 20 years of my practice, I have seen more non-athletes as a sports medicine physician than athletes. Okay. The other reason for that is that usually a professional athlete has his or her own doctor inside the club. For
Uh-huh.
example, most of the professional soccer teams around the world, especially the elite ones, they have their own doctor.
Hmm.
Okay, so usually these athletes do not come outside the club to see a doctor in a clinic, for example. So that's one of the explanations why in clinical practice we see more non-athletes than athletes.
Oh, I see. That's a very good point. Because let's say the professional clubs or teams, they usually have a doctor on board for, let's say, handling the team. I see.
Exactly, exactly. They refer the patients outside the club if you need some specific treatment that's not provided in the club.
Hmm.
Yeah, for example, there is no club that has an MRI machine inside the club.
Hmm.
Okay, so they need to refer those athletes to an MRI scan in a hospital or in a specialized clinic to do that.
Hmm.
Okay, but let's say that is an athlete with a ENT problem. So usually the club doesn't have an ENT doctor. So
Hmm.
those athletes need to be referred outside. Okay, but when you're talking about a sports medicine or even orthopedic surgeon, usually the professional club has this kind of doctor inside the club.
Wonderful. Doctor, can we say that sport medicine physicians see mostly people who have injuries, or do you see a mixture of people who come with injuries and chronic health problems, and you use, let's say, sport medicine to fix it? What's the majority of your clients or patients?
For sure, MSK issues. Okay, it's
Hmm.
someone that is playing golf with some friends and has a lower back pain. Is another guy that's playing cricket with the kids and had shoulder problem. Someone that plays paddle, that's a pretty common recreational sport here in Dubai, and has some tennis elbow issues. Okay, so most of the time we see people that are not athletes but get any kind of injury during sports participation. But it's not uncommon, for example, to receive a patient that has a desk job and they work 8, 9, 10 hours per day in front of a computer, typing a computer with neck pain. Okay,
Yes.
so we can see this kind of patient as well. Okay, so usually we see patients with a lot of MSK problems, but as I told you, time to time, we will see patients with palpitation, a patient that needs a better control of the diabetes through the exercise. There is a patient that has an indication from the cardiologist to do exercise to a better blood pressure control, and comes to my office to have some advice about what kind of exercise to do, how many days per week, in which intensity. So it's a broad field of work. Sports medicine is a very, very broad field of work.
Doctor, a question popped into my mind. We spoke about how physical activities and eating, let's say, healthy, is very good for our longevity. But why is it that also better for our mental health? How does training and good food affect our brain and mental health? Let's say, not speaking about the physical body, speaking about the mental health.
Okay, so the first thing, it's a physical benefits of exercise for our brains. Okay, so when you do exercise, you improve the blood flow to the brain. You will stimulate new connections between the brain cells. Okay, so during the exercise, we produce a substance called nitric oxide that can increase the blood flow for the brain. Okay, so this is a physiological thing. Okay, the second thing depends on the exercise, depends on the sport. This will demanding a good balance, a good coordination. That also a stimuli for new brain connections. Okay, for example, to play paddle is completely different to walk in a park.
Yes.
Okay, because the brain needs to think faster to play paddle, to save a point or to make a point, for example, than just walk in a straight line. Okay, so this is improved also physiologically speaking the mental health. Okay, but very, very important is to consider that sports exercise, it's a way to socialize. If you, for example, if you live alone, okay, you don't have too many friends, you start to have some problems related to the mental health, like anxiety, depression. Okay, once you start to be involved with sport, you start to play sport with new people, you can make new friends, you can socialize more. Okay, this is pretty important for the mental health, especially for old people, So someone that it's old, the kids are not living with them anymore. Okay, it's some old guy that already lost the wife, or an old lady that already lost the husband. If they don't socialize, if they don't go outside home to practice any kind of sport or any other kind of a social activity for the mental status, this is a disaster. Okay, and we have a lot of research proving that if you do exercise, if you do outdoor exercise in a beach or in a park, for example, this will improve your mental status as well. Yeah. So we have a poor physiological mechanism that can help with the mental status, but also we have the cognitive good positive impact of exercise, especially outdoors.
Very beautiful, actually, because I noticed that, for example, if I go for a run outside, I feel very different than if I go on a treadmill. Or if I train outside, for example, on the beach, as you mentioned, I feel like the exercise made me more alive somehow. Like something about being in the fresh air, the sun, on the beach with nature is like connects better to us humans.
Is the happiness of the exercise. I'm not saying that you should not exercise indoors. That's very important, especially consider the climate in the Middle East area. Okay, so during summer here, it's almost impossible to do some kind of exercise outdoors. Okay, so you need to move indoors to do that. They're pretty good. You should do that, but every single time that you have the opportunity to exercise yourself outdoor, it's better for your body, but it's much, much better for your mental status, for sure. I have no doubt about that.
Very beautiful. Doctor, growing old, what are the things that we need to consider when it comes to training? Like, can, for example, an elder person gain muscles as a young person or not? What does the
No,
changes that happen?
yeah, no, this is not possible. Physiologically, this is not possible. The aging process is unstoppable.
Mm-hmm.
Okay? So we need to consider that and we need to accept that. When I say accept that the aging process is unstoppable, is not say, okay, I will not exercise, I will not have a good nutrition from now because I'm getting old and doesn't matter what I do. But on the other hand, you will slow down the aging process with exercise.
Mm-hmm.
If you do the exercise as an old guy, you reduce the speed of losing your muscle mass. You reduce the speed of losing your body mass. You reduce the speed of losing your neurons, the brain cells, okay? So that is pretty important to know. And another important thing is the independence. An old person needs to be independent to do daily life activities, to go
Yeah.
to a grocery, to a supermarket, to carry weight, to drive a car, to have a good cognitive function. Okay, so the exercise will provide the people with a long life enjoying this kind of independence. So this is pretty important. Even for an old guy, an old lady that already has some kind of cognitive impairment, like Alzheimer's disease, it's important to keep moving because the exercise is one of the recommended treatment for that. Okay,
Mm-hmm.
this will not cure the Alzheimer's disease. Okay, this will not make the Alzheimer's disease comes back to the previous level.
Mm-hmm.
However, this will slow down the progress of disease, and this is pretty important for the quality of life. Talking about Alzheimer's disease, not only the quality of life for the patient, but maybe most important, the quality of life for the entire family. My father has had Alzheimer's
Mm-hmm.
disease. It was a disaster for the family. Yeah, so I know exactly what I'm talking about, not only as a doctor, but someone that had a case of Alzheimer's disease in the family. So if you can slow down the progress of disease through the exercise, through the good nutrition, through the good medication and new medications in the market, that's amazing. That
Mm-hmm.
means a better quality of life for the patient and also for the families.
You know, that's very beautiful because not a single doctor, not a single person which I've spoken to, they all literally say how important training, nutrition, and sleep to everything, to us as humans. Mental health, skincare, body, everything. Although it sounds like the secret or elixir for life, but it's very tough for people to do it for some reason. I don't know what is it about the human brain. It always tends to put us into the comfort zone.
Yeah, the problem is to convince someone to leave the comfort zone.
Yeah.
Yeah, so for a sedentary person to start the exercise, it's really very hard to do that. Okay, so I don't like to see so many colleagues, including sports medicine physicians or personal trainers or physiotherapists or whatever, is stating for someone in the office that people need to do exercise. You need to go to a gym. You need to lift
Yeah.
weight. Is not that way that it will work for that person.
Hmm.
Okay, so the first thing is move yourself a little bit more. I'm not asking you to go to a gym or to be involved in a pedal or a tennis or a golf class. Just move you a little bit more. Okay, so walk a little bit more. Instead of drive your car to the supermarket, go walking.
Yeah.
Come back walking, carrying
Bags.
the good. Yeah. So once you start to move a little bit more, and these people start to feel that the health status and the mental status is improving, it's natural that they will order. I think we lose connections.
No, it's fine. We're still there.
Okay.
Yeah.
So once these people start to do some increased movement during their daily life activities, they will be more prone to start a sports class, for example. So
hmm
don't push someone that is a
Actually,
sedentary to start any
like,
sport class. This will
person.
not work, and the people will drop out for sure. Okay, so start slowly, do some kind of exercise, move yourself around a little bit more. This is a pretty good start.
You know what you mentioned is very true, actually, because me being as a personal trainer, also I find it very challenging for clients to tell them, for example, let's think of the big picture. They will find it pretty challenging. However, giving them like a very small goal, as you mentioned, just move around a little bit more, walking around, doing
Exactly,
very simple things. Then the body
exactly,
starts
exactly.
habituating.
Let me tell you a secret. My wife hates exercise.
hmm
So it's a way for a sports medicine physician tell that, say that, but that's true. That's
Yeah.
true. She hates exercise. What I did with her, for her, okay? I bought a badminton set, two rackets, and one shuttlecock.
Yeah.
And I brought her to a park near home here and start to play badminton, not to score points, not in a court, just to not let the shuttlecock fall down.
Yeah.
She loved it. Okay, so she start to moving around. Yeah, she start to do some kind of exercise that's good for health,
Yeah.
for her health, and also it's good for me. And we can start some kind of sport as a family. That is also
Yeah.
important. So play football with your kids, play badminton with your wife, play paddle with your husband. That is pretty important. Okay. So if I try to push my wife into a gym, it will be a disaster.
Yeah.
Yeah. So after that, I pushed her to ice skating. I'm not an ice skater, okay, but I
Yeah.
like to, yeah. So I pushed her to do some ice skating, and she loved it. And it's a pretty good exercise, actually.
Mhm.
You don't need to be a professional ice skater to do that. You don't need to be an Olympic champion, okay.
Yeah.
At the beginning, it's very hard to balance yourself, yeah, but along the time you can do that for fun, and you start to do some kind of exercise. So the best approach for someone that doesn't like, that hates exercise, is find out a kind of exercise that looks like more a leisure activity, a fun activity, that exercise itself.
I
Okay,
see.
so the people should not thinking about, oh my gosh, I'm going to exercise. No, it's not that way. Oh, okay, let's go to the park to play some badminton. Let's go to ice skating. So let's do something different, for
Yeah.
fun. Okay, and at the same time they doing the exercise, but they not aware about the exercise. They
Yeah.
aware about the having fun. Yeah, this is a kind of a strategy. So don't ask your patient to do exercise. So ask your patient, what? Did you try to play badminton? Did you try
Yeah.
ice skating? Did you try to play paddle? Did you try to kayaking on Jumeirah Beach? So do you know
Yeah.
that they have kayak to rent there, and you can kayaking by yourself or with someone in your from your family? So do that for fun, and at the same time, they're doing exercise.
Yes, that's very beautiful, actually. I love it. Like approaching the exercise from a mentality of let's have some fun, because everybody wants to have some
Exactly.
fun.
Exactly. That's important. That's important. It's important to have fun for life. Okay.
Beautiful.
And not only for the body, but probably mainly for the mental status.
Yes, yes. Doctor, just a last question. Do you usually only work in clinics or do you approach hospitals? Because I heard that usually sport physicians don't work at general hospitals. So does a physician have a role in a hospital?
Yeah. Yeah, yeah. I remember when my contract finished in Doha in 2019. I was working for a sports medicine hospital there.
Hmm.
It was a sports medicine hospital specializing in sports medicine, and I was contacted by a general hospital there. And they asked me, "What can you, as a sports medicine physician, do here in
Mm.
the hospital?" I told them, "Listen, a sports medicine physician can help lots of other specialized doctors in your hospital. For example, your cardiologist has a patient that has a coronary artery disease and is taking medication for that. But this cardiologist has no deep knowledge on how to prescribe the exercise, the dose of exercise. A sports medicine can help your cardiology team with this patient to achieve the best result for the patient.
Mhm.
There is an endocrinologist in the hospital that is treating lots of patients with diabetes, but needs to have this patient moving around to help to reduce the amount of medication, to help to reduce the dose of insulin. So a
Yes.
sports medicine can help the endocrinologist with these patients. Okay. There is a rheumatologist that is seeing lots of patients with rheumatoid arthritis. And we
Yeah.
know that exercise, it's important to help control the pain and to reduce the loss of muscle mass and the loss of bone mass that happen when the patient needs chronically to take corticosteroids for the
Uh-huh.
treatment of rheumatoid arthritis. So a sport medicine inside this team can help the rheumatologist with his or her patients as well.
Hmm.
So we have a field of work very large inside even general hospitals, okay? And another thing is sports medicine. It's a kind of a medical specialty that carries a market aura.
Hmm.
If you is the owner of a general hospital and you have in your hospital a sports medicine service, the people outside will think immediately, oops, maybe the hospital can treat elite athletes. If there is someone
Yeah.
there that can see elite athletes, this guy can help me with my health issue as well.
Yes.
So it's a kind of a market strategy for a general hospital.
I see. That's actually very smart. Because as you mentioned, for example, the first thing that pops into the mind of the people when they hear the name sports medicine physician is treating elite athletes or sports personnel. So having that on your team is going to give an aura and energy for the hospital. Very
Yeah,
beautiful.
and that's why that since several years ago we introduced the term exercise in the name of the specialty.
Uh-huh.
So today we don't call anymore sports medicine. We used to call exercise and sports medicine. Okay. In Brazil, for example, the National Sports Medicine Society is the Brazilian Exercise and Sports Medicine Society.
Ah.
Okay. Just because we need to be viewed not only treating elite athletes,
Mm-hmm.
so the name of sports medicine carry this misinformation. When you
Very
put
smart.
exercise in the name of the specialty, lots of people that are not elite athletes can understand that a sports medicine physician can help them with their health issues as well.
Very beautiful. Dr. Jomar, do you have any final note, any final advice that you would like to give the people from your experience in this field? Like after many years of experience, what can you tell the audience and the people out there?
It's something that I used to say to my patient and also in my social media is that don't try to do every single day everything that everybody tells you that's good for your health. You have no time to do that. Okay? So it's impossible during a single day, 24 hours, to sleep well, do 30 minutes of exercise, have a health food intake, don't stress yourself. Do some respiratory exercise. Do some stretching exercise. That is impossible. Don't push you
Yeah.
too hard to do that. Okay? So you don't have this time. You need to work. You need to pay your bills. You need to take care of your old parents. You need to take care of your kids. You need to take care of your pets. So 24 hours a day is not enough to do every single thing that we see on the internet in social media.
Yes.
Okay? So try to do your best. Every single day, choose at least one thing that's good for your health. So today, I need to sleep 8 hours per night. I will do that. Today, I need to do 30 minutes of exercise. Today, I need to eat salad. Today, I need to do a yoga class. Today, I need to walk my pets. Okay? So do
Mm,
that in small pieces along your week. So you will have a healthy life, you will have a happy life if you do that. If you try to push yourself to do every single thing that you see on the internet that's good for your health, you'll be crazy.
Doctor, that's very smart. Thank you so
It's not
much.
achievable. It's not achievable.
Yes.
Forget about that.
That's very good advice, actually, because people usually get overwhelmed by the amount of
Exactly.
information of the things that they have to do.
Exactly. And we don't have time.
Yes.
We don't have time to do every single thing. Okay, so try to choose one or two during your day and do that one. Okay,
Wonderful.
and at the end, your general health or mental health will be better. Believe me.
Thank you so much, Dr. Jomar. Your time is very well appreciated, and I had a very wonderful conversation with you. Thank you so much. I wish you all the best and nothing but the happiness. And I hope to see you again soon.
My pleasure. Take you to any time that you need. I'm here. Just contact me.
Thank you, Dr. Jomar. Take care.
Thank you. Bye bye. See you.